Come in.
Hi, Mrs. Ross. My name is Sarah. I'm going to be your nurse today. Do you mind verifying your name and date of birth for me?
Christina Ross, November 9th, 1995.
Okay, I'm going to go wash my hands. I'll be right back. Okay, I'm going to close your curtain for privacy. Today we're going to be doing a complete head-to-toe assessment. It's going to require me to test your head, eyes, ears, nose, and throat, as well as your respiratory rates and heart rates, and your motor neurological function. Are you okay with that?
Yes.
And do you feel safe and comfortable in the position that you're in?
Yes.
Okay, and can you tell me where we are?
The exam room.
And do you know what day of the week it is?
Thursday.
And who's our current president?
Donald Trump.
Okay, patient is alert and conscious to place, date, and time. The speech is clear, no stutters or abnormalities within the speech. The patient is well groomed and is dressed appropriate for the weather and the occasion. We're going to go ahead and start with the cranial nerve assessment. I'm going to start by inspecting your scalp for any lesions, any swelling or masses, no masses noted, or parasites. Now we're going to start with your nose. I'm going to take a look up your nose. Shine a light up there. Okay, no redness or swelling or discharge. The nasals are bilateral on both sides. Okay, now we're going to go ahead and check cranial nerve 2, which is your optic nerve. I'm going to start by looking at your pupils and your eyes. Your eyebrows are symmetrical. The eyelashes curve outwards and are symmetrical. The pupils are round. Your sclera is white. Can you pull down on your conjunctival sac for me? Okay, the conjunctival sac is pink and moist. No bacteria or parasites in it. No abnormalities. You can let go. Okay, I'm going to have you look into my light. Okay, I'm going to have you look far and close. Okay, and the eyes are 3+ bilaterally and they're perla. Now I'm going to have you do, we're going to test your vision by doing a confrontation test, okay? I'm going to have you cover one eye and tell me when you see my fingers.
See them. See them.
Okay, go ahead and cover the other eye. Tell me when you see my fingers.
See them. See them.
Okay, the patient was able to see where my fingers were with her peripheral vision and was able to do the confrontation test. Cranial nerve 2 is intact. Now we're going to do cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. I'm going to go ahead and test your vision by doing all 6 cardinal directions of gaze. Okay, I'm going to test your eye movements. Just follow my pen. Okay, patient is able to follow my pen in all 6 cardinal directions of gaze. Cranial nerve 3, 4, and 6 is intact. Now we're going to do cranial nerve 5, which is the trigeminal nerve. I'm going to go ahead and touch your face, and you're going to go ahead and just tell me when you feel it or where you feel it, okay? Close your eyes.
Head. Cheek. Chin. Cheek.
Okay, I'm going to pull down on my finger. Okay, patient was able to feel where my fingers were placed in all 4 places, and jaw strength is a 5 out of 5. Cranial nerve 5 is intact. Now we're going to do cranial nerve 7, which is the facial nerve. I'm going to go ahead and have you smile and frown, raise your eyebrows. Okay, cranial nerve 7 is intact. Now we're going to go ahead and do cranial nerve 8, which is the acoustic nerve. I'm going to go ahead and do a hearing test. First, I'm going to check your external auditory meatus for any redness or swelling. No redness or swelling or extra cerumen is noted. Okay, no redness, no swelling or extra cerumen. Okay, now we're going to go ahead and do the whisper test. I'm going to have you occlude one ear for me. I'm going to whisper something and you repeat it, okay?
Christmas. Dog.
Okay, patient was able to repeat back what I whispered and was able to complete the whisper test. Cranial nerve 8 is intact. Now we're going to do cranial nerve 9, which is the glossopharyngeal. I'm just going to go ahead and have you swallow. I'm going to watch you swallow. Okay. Cranial nerve 9, the glossopharyngeal nerve is intact. Moving down to cranial nerve 10, I'm going to go ahead and have you open your mouth. I'm going to look at your mucous membranes in your mouth. Okay, the cheeks are pink and moist, no sores or any lesions noted. I'm going to have you say ah. Okay, uvula rises with phonation. Cranial nerve 10, the vagus nerve, is intact. Moving down to cranial nerve 11, we're going to do the accessory nerve. I'm going to have you shrug your shoulders up on my hands, lean side to side. Okay, patient was able to push up against resistance and turn her head side to side. Cranial nerve 11 is intact. Lastly, cranial nerve 12, the hypoglossal nerve. I'm going to have you stick out your tongue. Take a look at your tongue. Okay, the tongue is midline, no ridges or lesions noted. Okay, that's going to conclude the portion of our cranial nerves and head, eyes, ears, nose, and throat. Now I'm going to feel your lymph nodes. Okay, I'm going to start with your submental, then your submandibular, then your your preauricular, your postauricular, your occipital, your anterior clavicle, your posterior clavicle, then your supraclavicular. Okay, no abnormalities noted with the lymph nodes. All were present. Now that's going to conclude our head, eyes, ears, nose, and throat portion. Now we're going to move down to the respiratory portion. I'm going to start by observing your anterior diameter. Your anterior diameter is less, your anterior posterior diameter is less than the transverse diameter. The skin color is still consistent with the ethnicity. There's no redness or swelling. I'm going to go ahead and start by monitoring your breath. I'm just going to watch your respiratory rate for 15 seconds. If you just breathe normal, then I'll multiply that by 4. So you just breathe normal. Okay, and after 15 seconds, we multiply that by 4. It was 17. We get 68 for your respiratory rate. There were no extra muscles used or any coughing noted, and no abnormalities with the respiratory rate. Now I'm going to go ahead and start with the front. I'm going to go ahead and check for chest expansion. Take a deep breath. Okay, chest expansion is symmetric. Now I'm going to go ahead and check for tactile fremitus. I'm just going to have you say 99 every time I touch, okay?
99, 99, 99, 99, 99.
All right.
99, 99, 99.
Okay, and tactile fremitus is even throughout on the anterior side. Now I'm going to go ahead and listen to all 8 sounds on the front side, okay? You can just breathe normal for me, or take a deep breath, sorry. Okay, and then we'll check your axillary breath. Thank you. Okay, and all 10 respiratory sounds were clear throughout, and no adventitious sounds were heard. Now I'm going to go ahead and have you turn around. I'm going to do the posterior side. Just want to turn this way. Okay, I'm going to check for your chest expansion. Deep breath. Okay, chest expansion is symmetrical. I'm going to do the same thing with tactile fremitus. Have you say 99. Okay.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile fremitus is even throughout. Now I'm going to go ahead and listen to all 8 respiratory sounds on the back. Just take a deep breath for me. Okay, you can go ahead and turn back around for me. All 8 sounds were clear and no adventitious sounds were heard on the posterior side. Now I'm going to go ahead and check your carotid artery. I'm going to start by feeling both sides, by palpating. Okay, and there are 2+ bilaterally. Now I'm going to go ahead and listen with the bell of my stethoscope to your carotid artery. Just take a deep breath for me. Okay. Okay, and after listening to the carotid artery, there were no bruits noted. Now I'm going to go ahead and palpate your chest area. Okay, there are no heaves or thrills noted. Now I'm going to go ahead and listen to all of your heart sounds. Just going to have you breathe normal for me. I'm going to start with your aortic valve, which is located in the second intercostal on the right sternal border. Moving over to the pulmonary valve, which is located at the second intercostal on the left sternal border. Moving down to the third intercostal space on the left sternal border, which is the Erb's point. Okay, now moving down to the tricuspid valve, which is located at the fourth intercostal space on the left sternal border. Okay, and lastly, we're going to move down to the fifth intercostal space, which is the mitral valve. Okay, and after listening to all 5 sounds, there were no extra heart sounds heard or any murmurs. Okay, that's going to include the cardiorespiratory portion of our exam. Now we're going to move down to the gastrointestinal portion of our exam. I'm going to go ahead and have you lay down on my couch. Make yourself comfy. Okay, I'm going to start by observing the abdomen. The abdomen is round, and there's nothing protruding, no abnormalities, no redness or swelling. Okay, first I'm going to start by auscultating your abdominal quadrants. I'm going to listen for bowel sounds. Take a deep breath for me. Okay, and bowel sounds were heard in the abdominal quadrants. Okay, now I'm going to go ahead and palpate lightly each quadrant and tell me if you're feeling tenderness. Any tenderness? Any tenderness? Any tenderness? Any tenderness? Okay, patient feels no tenderness. There's no tenderness or rigidity. I'm going to palpate just a little bit deeper. Tell me if you feel any tenderness. No. Okay, after palpating the abdominal region a little bit deeper, the patient felt no tenderness. There was no rigidity noted. Okay, you can go ahead and sit back up. And when was your last bowel movement?
Yesterday.
Okay, have you had frequent urinations? No.
Yes.
All right. Okay, that's going to include the gastrointestinal portion of our exam. We're going to move into the last portion of our exam, which is the neurological and motor skills portion of our exam. I'm going to start by checking for any edema or tenderness. Okay, no edema, no swelling. The skin feels warm to touch. Okay, and the skin is consistent with the ethnicity. Now I'm going to go ahead and check for capillary refill on your fingers. Okay, and no abnormalities with that. The color comes right back. Now I'm going to go ahead and check your strength in your neck. You're going to turn your neck side to side for me, and all up and down, all around. Okay, neck strength is a 5 out of 5. Now I'm going to go ahead and have you hold your arms out for me. And now just make it like a T and then back. Okay, patient is able to move arms in all 3 directions as well. Arm strength is a 5 out of 5 for mobility. Now I'm going to have you kick your leg out, back, and around, move your feet around. Okay. Mobility in the legs and the strength is a 5 out of 5. Okay. Now I'm going to go ahead and do the Romberg test. I'm going to have you stand up for me and close your eyes. I'm going to count to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, can you go walk in a straight line for me that way? Okay, and no swaying or imbalance is noted. The Romberg test is a negative. Yes, a negative. Okay, there's no swaying or balance issues with that. The Romberg test was completed. Now we're going to go ahead and check all of your reflexes. I'm going to go ahead and start with your triceps reflex. You can stick your arm out for me. Okay, thank you. Okay, and the patient's triceps reflex is a 2+ bilaterally. Now if you could hold your arm out for me, we're going to do the biceps reflex. Okay, and the biceps reflex is a 2+ bilaterally as well. Now I'm going to check your brachioradialis. Okay. Okay, the brachioradialis is a 2+ bilaterally. Now I'm going to move down to your patellar reflex. Move the camera down. Okay, I'm going to go ahead and palpate for the patellar reflex. You go ahead and hold your hands like this for me. Okay, same thing. Palpate for the patellar region. And strike. Okay, the patellar reflex is a 2+ bilaterally. Now check your Achilles. Okay. The Achilles reflex is a 2+ bilaterally. Now I'm going to do your dorsi plantar reflex. I'm going to move my pen upwards. Okay, and the toes curve. The toes curl outwards. Okay, same thing. The toes curl outwards. The plantar reflex is a 2+ bilaterally. Okie dokie. Now I'm going to go ahead and palpate each of your pulses in your arms and your legs. I'm going to start with your brachial. Do radial. Okay, I'm going to do your popliteal. Okay, and do your tibial. Okay, and there were no brutes or anything felt when palpating the, no brutes. That was the wrong term, but there was no abnormalities when palpating the pulses. And that is going to include our head-to-toe assessment. Do you have any questions for me? Okay, and then here's all of your belongings. I'm going to go wash my hands. And do you feel safe where you're at?
Yes.
Okay, did you have anything else you needed?
No.
All right, did you want your privacy curtain open or closed?
Close.
Thank you.